So with that, I would like to take an opportunity to introduce Nancy Webster, the Chief Executive Officer for St. Luke's Rehab Institute. Nancy.
Actually, Ed, it's good to see you. And Daryl said that you just called me old. I said, no, seasoned. So, because I think he just called you old. Because you said I've been part of this for a long time. So thank you for allowing me to come here and share St. Luke's story and how we're a partner with all of you. So what I'd like to do is give a brief overview, and I know that I'm on a time constraint. So I will start with our history. It actually started in 1897. And St. Luke started as a 15-bed hospital many, many years ago, different location, $900. Caregivers look very different back in those days. We move forward to 1968, groundbreaking, and this is where we currently exist. It's at 711 South Cali. The building on the right is the building that exists today. Other than some changes, actually, as part of making us safe, we do have some safety features in our building. So St. Luke's Rehab, we're the largest, most comprehensive in the region, freestanding rehab. We have a continuum of care at St. Luke's, from acute care all the way to inpatient, to home health, and to outpatient. We have different innovative therapy solutions that I'll touch on in a moment. And then we have accreditations. We have our CARF accreditation, which is a rehab accreditation. We have our Joint Commission, and then we are designated as a level 1 trauma in the state for spinal cord and brain injury. Some of the clinical expertise at St. Luke's, we have our physiatrists. They're unique to rehab. And we do have some of our physiatrists board certified in spinal cord brain injury or stroke. Our hospitalists actually come from Sacred Heart. We have hospitalists on site from 7 a to 7 p, and then at night they're on call for us at St. Luke's. And we're actually going to telehospitalists in January that we can have the hospitalist at the bedside with technology for our patients and our nursing staff. We have our registered nurses. They have different certifications for rehab. And then, of course, we have our therapy staff that carry different certifications. 102-bed facility. We have just shy of 700 employees. I think it's 697 was what I was told by Human Resources. On site, we have our therapists at St. Luke's, but we also have therapists at Sacred Heart and at Holy Family Hospital. And then we also provide staffing services to St. Joe's Care Center, which is on the South Hill, close to where we're at. And then to 6 of the rural hospitals, as needed, we have PT, OT, and SLPs that go out to those areas when they're asked for coverage. And then we also have our 10 outpatient locations throughout this Spokane area and our occupational rehab locations. Some of the innovation there at St. Luke's, for those of you, I know some of you have been on site to our campus, we have our indoor-outdoor community, and that's where we actually integrate our patients. We have modules downstairs in the basement of our facility where we have a plane fuselage, we have a bus, we have a restaurant, etc. But it's to really integrate the patient in a very safe environment before they go out to the community. And then we have an outdoor community that has a racetrack around the perimeter, and then there's different surfaces outdoors to navigate for our patients as they are integrating back out. We do have a therapy pool. We have our driving simulator. That's new technology for us. There's a better picture here in a moment of it, where we do in-clinic driving evaluations, and then if the patient is safe, they go out in the community. We have a car that's modified for us to actually do training with modifications for patients that now have some type of disability and they need to drive with some modifications. We have our pediatric gym area, our assistive technology lab, and then we have some other technology that we use for therapy, and then we have an apartment. A lot of our patients come from the rural area, so we have an apartment that they're able to simulate before they go home that has all the call systems in it. And then we also have our family-centered care and then cross-generational healing. Team approach, I'm not going to list all these out. Rehab is a comprehensive team approach, and so you have your therapist and your psychologists, social workers, case managers, chaplains, etc., that are very much a part of the team that touch the patient when they're at St. Luke's Rehab. Return to the community, that's our primary focus with our patients. So we do have Team St. Luke. They do the recreational and competitive sports program. We have our quad rugby team, and we have our basketball team that are out there in the region and also in the nation to compete. Aging into Driving is the simulator, and it's actually located on the lower left corner, that it's 3D for those patients that need to drive and get back out there into the community. And then we do our education reintegration, and we bring in, through the school district, we'll bring in tutors. We can use AT Lab, where we've actually connected our young adults into the classroom because they don't want to miss the schooling. And it's also a great way to integrate them back with their peers, and that's the accessibility into the classroom. A part of St. Luke's not a lot of people know is COHE. It's the Center of Occupational Health and Education, and it is the Eastern Washington COHE. It's in collaboration with LNI, and you can see some of the numbers. They have more than 1,200 providers. They touch 20,000 injured worker claims annually that as they work with LNI and touch those different areas. And they are throughout 19 counties in Eastern Washington. Some real quick metrics just to share some of those. We have a focus on quality and growth. The one, I'll just touch on overall satisfaction. We use Trust Gaining, 93.5. Photo is an outpatient metric for focus on therapeutic outcomes, 96.25. And then our referrals continue to grow in the outpatient world, so 23% this year from the prior year. And then the one up above, improving quality of life. 3 months after a patient leaves St. Luke's, we use MedTel outcomes, and we really need to know how is the patient doing now that they've integrated into the community. And the score is based off of 1 to 4, and we're at the 3.6 on our year to date. So this is where I wanted to get for the meeting today, and I know that was a real brief overview of St. Luke's, but how are we a partner with all of you? And like I said in the beginning, I'm very excited. I was telling Daryl, I remember in the beginning when Erica started the Healthcare Coalition and was at St. Luke's for meetings, we've always focused on being a high reliability organization. However, in 2015, and we are part of Providence, Providence brought to light the HPI, which is Healthcare Performance Improvement. And it's an initiative to really focus on and hardwire how do you become a quality place and a safe place. And we started working on those different initiatives. And the areas that we've hardwired to date, we do safety huddles. And we have a safety huddle that we do 365 days a year. It is at 9:15 every morning, and it doesn't matter whether it's a holiday or not, and our leaders call in if they aren't on site or they're in a room. And what do they talk about? They talk about what has happened in the last 24 hours, if there's any safety events, and what in the next 24 hours do we need to be concerned about. The safety huddle, actually, we're a part of the Sacred Heart Safety Huddle, and we have some of our leaders that are over there on that safety huddle. The other safety huddles we do is every one of our areas does a safety huddle. So nursing does safety huddles at the beginning of every shift. They've gotten pretty, they're getting pretty innovative. They actually, when our staff come on board, they do not get their assignment until they go to the huddle. So the huddle's a touch point for them to give information about what's going on, if there's anything in the facility, any safety concerns, any patient areas that they need to know about, and then they get their assignment and they go on their way. The learning boards are another tool that we hardwired throughout St. Luke's and actually throughout the organization. And the safety board, and I should have brought a picture, is actually, it's a real simple board. It has 3 sections. And the bottom line is, the focus is to have the caregiver at the front line not be afraid to speak up for safety. So if they see anything or they have any concerns, they can put it on the board in their area, and it moves across the board until there's resolution. And obviously on some things you can't find total resolution, but you communicate back and you work with the caregiver to say, this is what we're doing, or help us. And they're a part of the solution as we look at those learning boards. And in our primary location where we do the bigger safety huddle, there is a board that we use and we call out different things that are safety issues. The other things that we've worked on at St. Luke's over time, and this is actually thanks to Tracy Fetch, who I know is usually at these meetings. He's in a meeting all afternoon today. I met with him this morning. I just have to say thank you to Tracy Fetch and his team. They've been phenomenal at really working with us in collaboration with Daryl, and I have to give thanks to Daryl. We started years ago of having our leaders do ICS training. We have many leaders that have completed all of the ICS training, 100, 200, and 700, and then we have a combination throughout. Tracy identified that we have new leaders and they're starting over again to get them engaged in the training. The other area that we started sending our leaders to is the healthcare leadership during mass casualty incidents in Anniston. And I have to thank Daryl for this. He and actually Tracy brought it forward that we need to send leaders. We've sent, I believe it's a third of our leaders to date to the training, and I have to say this training has truly benefited St. Luke. The leaders that go there, we've practiced incident command at St. Luke. Daryl's helped us, Tracy's helped us. We have all the rules. We have our incident command center with all the books. But the leaders that have gone to the training come back with such a better understanding of how and why they are running the incident command and the reasons and the role that they play. So there's more leaders that we're sending. It's covered through FEMA, and I highly encourage, if you haven't attended or any of your leaders, I would highly recommend you go. It's not always easy to get in. There's certain slots, but we work closely with Daryl to get our leaders there. So it's helped us at St. Luke as we have actually had those moments that we need an incident command center. And Daryl asked me to share one of those. I'll share it in a moment. But I have to say we now do incident command for almost everything that happens in our hospital because it streamlines what is going on and what the incident is. If we have a code purple where we have a patient that has left our facility and we cannot find, we have an incident command center. We've had the opportunity to, and I'll touch on events at the end, to actually put this into action and lessons learned. So we needed a new generator. St. Luke's had a generator. St. Luke's has been there since 1994 in current state as St. Luke's Rehab. Nobody knew how old the generator was. We have windstorm. Windstorm taxed the generator on a wish and a prayer. 23 hours it was running at our hospital. On the South Hill, we were without power. So we knew we needed a new generator. So we got a new generator because that was the right thing to do. New generator comes, tested, everything's put in place, and we have a power outage. So it's an Avista power outage. Power's out. Generator did not kick off. What happened is the power all came in, and I'm speaking from Michael now, our facilities guy, can explain to me how this works. Power all surged in, but the breaker didn't go, so it didn't kick through the hospital. I was actually off-site receiving lots of messages, all the power's down, generators not kicking in, and the team went into action. I was with my daughter who was delivering a baby at Sacred Heart Hospital, and the team went into action for 17 minutes, which doesn't seem like a long time. They went into incident command mode. And it was because they were prepared with what Daryl has helped us to understand the incident command, but it's also the practice. We practiced it over and over. And it was a successful outcome. They were able to go into internal emergency mode, and it was successful in the end. And the power came back on. our new generator's fixed, and we actually ran a test, and it's good to go. The other thing that we prepare for is our events. And so there's community events that impact every one of us. So whether it's Soup Fest or Bloomsday, and when you look at what happens today, just out in our community, in our region, in the nation, and on and beyond, we prepare for everything. And Daryl does a great job of kind of laying out that plan. What does it look like? What does it look like for the hospitals? What does it look like for St. Luke? Because we're all part of it. I mean, every one of us are part of that as a partner. And so it's really helped us to always look at where is safety. I love how you start the meeting. What's our emergency route out of this room in the event that we would need them? Because unfortunately, we live in that society where we need to know that. So I just wanted to share those pieces of St. Luke that we do.